Welcome to aminacademy.com. In abnormal psychology regarding OCD, let us discuss about what are the treatments for OCD. First, how to diagnose. Psychological evaluation. This includes talking about your thoughts, feelings, symptoms, and behavior pattern to find out if you have obsessions or compulsive behaviors that get in the way of your quality of life. With your permission, this may include talking to your family or friends. Physical exam. This may be done to rule out other issues that could cause your symptoms and check for any related complications. Some diagnostic challenges. It's sometimes hard to diagnose OCD because symptoms can be like those of obsessive compulsive personality disorder, anxiety disorders, depressions, schizophrenia, or other mental health disorders. And it is possible to have OCD and another mental health disorder. Work with your doctor so that you can get the right diagnosis and treatment. What are the treatments? Obsessive compulsive disorder treatment may not result in a cure, but it can help bring symptoms under control so that they don't rule your daily life. Depending on how serious your OCD is, you may need long term, ongoing, or more intensive treatment. The two main treatment for OCD are psychotherapy and medicines. Psychotherapy, also is known as talk therapy, often a mix of both treatment is most effective. What is psychotherapy? Cognitive behavioral therapy, CBT, a type of psychotherapy, is effective for many people with OCD, exposure and response preventions, ERP, and part of CBT therapy involves exposing your over time to a feared objects or obsession such as dirt. Then you learn ways not to do your compulsive rituals. ERP takes effort and practices, but you may enjoy a better quality of life once you learn to manage your obsession and compulsion. What are the medicines? Certain psychotic medicines can help control the obsession and compulsion of OCD. Most commonly, antidepressants are tried first. Some medicines: fluoxetine, fluoxamine, paroxetine, sertraline, and clomipramine. Medicine, what to consider? When talking with your doctor about medicines for OCD, consider medicine selection. In general, the goal is to effectively control symptoms at the lowest possible dose. OCD may be sometimes require higher doses of medicines to be the most effective in controlling your symptoms. It's not unusual to try several drugs before finding one that works well. Your doctor might recommend more than one medicines to effectively manage your symptoms. It can take weeks to months to get better after starting a medicine for your symptoms. All psychiatric medicines may have side effects. Talk to your doctor about possible side effects and about any health monitoring needed while taking psychotic drugs. Suicidal risk. Most antidepressants are generally safe, but the FDA requires that all antidepressants carry black box warning. These are the strictest warnings for prescriptions. Interaction with other substances. When talking an antidepressant, tell your doctor about any other prescriptions medicines available without prescriptions, herbs, or other supplements you take. Stopping antidepressants. Antidepressants are not thought to be addictive, but sometimes physical dependence can occur. Stopping treatment suddenly or missing several doses can cause withdrawal like symptoms. Sometimes psychotherapy and medicines cannot control OCD programs. In cases that don't respond to treatment, other options may be offered. Intensive outpatient and residential treatment program. Full treatments program that stress ERP therapy principles may help people with OCD who struggle with being able to function because of how serious their symptoms are. These programs usually last several weeks. Deep Brain Stimulation (DBS). The FDA has approved DBS to treat OCD in adults ages 18 years and older who don't respond to traditional treatment. Transcranial Magnetic Stimulation (TMS). The FDA has approved three TMS devices: Brainwave, MagVenture, and NeuroStar to treat OCD in adults. Now we'll discuss further detail about what are the treatments for OCD. The main treatment for obsessive compulsive disorder (OCD) are psychotherapy, specifically cognitive behavioral therapy or CBT, includes including exposure and response preventions or ERP and medicines, often selective serotonin reuptake inhibitors. These are the medicines some name. Psychotherapy. The most effective form of psychotherapy for obsessive compulsion disorder (OCD) is cognitive behavioral therapy (CBT), specifically through a technique called exposure and response prevention (ERP). ERP involves gradually exposing individuals to their feared triggers and helping them resist performing compulsive behaviors, which lessens anxiety over time. This tailored approach helps people change their thought pattern and behaviors, with many patients responding to this type of therapy. Cognitive behavioral therapy. This talk therapy helps you identify and change unhealthy thought patterns and behaviors. Exposure and response preventions (ERP). This is a type of CBT where a therapist gradually exposes you to the thing you are fear and helps you avoid performing your usual compulsive rituals. Psychoeducation. You will learn about OCD and the treatment process. Relapse preventions. Strategies are taught to help maintain gains after treatment. Some medications. Some selective serotonin reuptake inhibitors (SSRIs). These are common medications that help regulate mood. Next one is tricyclic antidepressants. Drugs like clomipramine increase serotonin and norepinephrine in the brain to help regulate mood. Augmentation. Sometimes other medicines such as atypical antipsychotics are added to SSRIs treatment. Some other treatments: transcranial magnetic stimulation (TMS) for severe OCD. This non-invasive treatment uses magnetic fields to stimulate the brain. Deep Brain Stimulation (DBS). This involves implanting a device in the brain to target specific areas and is approved for chronic severe OCD cases. Deep Brain Stimulation (DBS). Deep Brain Stimulation (DBS) is a neurosurgical treatment for severe treatment refractory obsessive compulsive disorder (OCD) that involves implanting an electrode into specific brain areas connected to a device like a pacemaker that delivers electrical stimulation to regulate brain activity and reduce symptoms. It is a last resort option for individuals who have not responded to standard treatment like psychotherapy, especially exposure and response preventions ERP and medicines. DBS can improve symptoms but is not a permanent cure, requiring continuous stimulation for effectiveness and potentially needing adjustment over time. Some support groups. Connecting with others who have OCD can provide mutual support and coping strategies. Some key consideration: no cure but manageable symptoms. While OCD may not have a cure, these treatments can help bring symptoms under control. Professional guidance. A mental health professional can help determine the best treatment plan for you. Long term management. Treatment for OCD may be long term and require ongoing effort and practice. So far, we discussed about what are some treatments about for OCD. We have done. Please subscribe our channel.